each case to provide a little update on the particular infection of interest. This is also going to be an interactive format, so I encourage you to have your iPads and iPhones ready to vote as we go through some of the cases. So the first case I want to talk about is the first president, the father of our country, George Washington. George Washington died only 2 or 3 years after he left the White House. And his death was remarkable for the sudden, very, very sudden dramatic onset of hoarseness and a severe sore throat one day after he went horseback riding on his estate. This became a rapidly progressive process, high fever, chills. The best attending physicians of the day gathered around and mused over what to do. And actually, a young medical student suggested that they try an experimental procedure called a tracheotomy to try to save the president's life. After reflecting on that a little bit, though, the attendings, being attendings, wisely rejected that idea and proceeded to do bloodletting, which didn't really help much. And he died within a day of his illness. And so here's a couple of prints from Currier and Ives and other artists, maybe to help you a little bit with your first question. What is it that most medical historians believe that was the cause of death for George Washington? Was it A, group A streptococcal supraglottitis, also known as quinsy? Was it B, parainfluenza virus 3 laryngotracheitis? Was it C, a foreign body aspiration? Was it D, Haemophilus influenzae epiglottitis? Or was it E, Staph aureus tracheitis? So go ahead and vote. And we'll see what the audience thinks. Okay, a couple of votes for strep. No one bit for the paraflu or the staph. And so you guys are right. It actually was a case of epiglottitis. And I think the clue was the sort of dramatic and sudden onset of his illness. And so as many of us remember, epiglottitis is a rapidly progressive illness. Here's what quinsy might have looked like, a peritonsillar disease process due to group A strep. But here's classic epiglottitis. And those of us of a different generation of pediatricians remember the lateral neck x-rays we'd routinely get in the ER during croup season. The cherry red epiglottis on laryngoscopy, and then the pleomorphic small gram negative coccobacillus that is Haemophilus influenzae. So older pediatricians always like to talk about how many LPs they would do on a typical call night when H. flu disease was running rampant. Why should we care about it today? The reason I think we should care about it is that it's still a disease seen in adults. There's always a differential diagnosis that includes H. flu epiglottitis with upper airway disease. And there's a need for ongoing immunizations, as you know. The routine is to give 3 or 4 doses of Hib vaccine, depending upon the product that you use. There has been a dramatic impact on the prevalence of Haemophilus influenzae type B disease, dropping from a peak in the mid-1980s down to almost negligible numbers. But I want to remind people that here in Minnesota, we saw a resurgence of invasive Hib disease in the last 3 or 4 years. And this it remains incompletely explained, but it's a disease, I think, that's forgotten but not gone. We do need to remember that there are many parents who refuse immunizations. Here's data from the MMWR, looking at the percentage of infants who by age 7 months had received 1, 2, and 3 doses of Haemophilus influenzae type B Hib conjugate vaccine. This is from the Minnesota Immunization Information Connection. And you can see that completion of the 3-dose series is only in about the 50% range. Why is this? We have such a spectacularly successful vaccine and yet parental noncompliance. I think it has something to do with the aggressive push against vaccines that many parent groups and other groups have been pursuing. And it all started with this paper published by Andrew Wakefield in the British Medical Journal. This paper suggested that there was some sort of a connection between MMR vaccine, different vaccine, but the damage was done. And of course, this connection was false. And Wakefield didn't tell the world that he was a paid consultant for lawyers who were working to try to prove a link between MMR vaccine and autism. He'd been paid over £1 million. Virtually all of the children in his study were actually recruited from the lawyer's office. They were involved in the ongoing litigation. There was no informed consent when he drew blood and did invasive procedures on the children. The tissues obtained during endoscopy were uniformly negative for MMR sequences, but this information was never disclosed in the paper. And Wakefield himself held a patent for a monovalent measles vaccine and tried to make the claim that it would be safer to give a child measles alone, that something about mixing it with the mumps and rubella moiety is what led to the autism. 10 of the 13 authors of this paper retracted their names, and then more recently, Lancet actually officially retracted the paper a couple of years ago. So bear in mind that there still is a circulating Haemophilus influenzae type B disease, potentially in Minnesota. There's colonization. There's parents that refuse vaccines. Of the 4 invasive cases that I described from the Minnesota Health Department, 2 of those children were completely unimmunized, and 1 of those children died. So I think we need to continue to be strong advocates for all vaccines, but particularly a vaccine as safe and effective as Hib. Well, what about James Monroe? James Monroe was elected president twice, in 1816 and 1820. Interesting historical tidbit, he was the last Revolutionary War veteran to be elected president. His presidency was remarkable for a pretty peaceful mood in the United States of America. Historians call it the era of good feeling, and of course he's remembered today for the Monroe Doctrine. Unfortunately, James Monroe had a lot of recurrent fevers in office. He would suffer recurrent bouts of chills, prostration, be bedridden with aches and pains. This really sort of began in his days in military service in the Mississippi River Delta in the late 1700s. He had an incapacitating seizure in 1824 and then died not long after that. And so what was the source of James Monroe's FUO followed by his incapacitating seizure and finally fatal illness? Did he have cerebral malaria? Did he have viridans endocarditis with an associated mycotic aneurysm? Did he have lacrosse encephalitis? Did he die of rabies? Or did he have pneumococcal meningitis? Think about those options. And we'll see what everyone has to say. Okay, pretty equal mix. Let's see if there's any late voters here. Be sure and bring your voter ID. So a tie between cerebral malaria, pneumococcal meningitis. A lot of people went for the lacrosse encephalitis. So an interesting mix of responses. So let's talk more about James Monroe. And I'll give you the denouement. In fact, James Monroe had malaria. He had chronic malarial infection. And these maps from even early, as late as the mid to late 1800s show the areas of the United States where malaria activity was still indigenous, including much of the Mississippi River Valley. And so it's an interesting historical footnote that James Monroe probably had malaria. He probably had falciparum malaria. In my discussions with Chandy John, he points out that even though vivax is the predominant species in the Western Hemisphere today, that most historians believe that P. falciparum, which of course has a higher magnitude of parasitemia, is more likely to be associated with severe disease, was prevalent at that time.
So Mark, on that map, so Minnesota had malaria?
Yep, here it is right here, Tony. Right here's Minnesota. And so this is 1862, and I couldn't find older maps, but it's widely believed that it was as far north as the Minnesota border. So what's new with malaria? I just wanted to update you a little bit. It still continues to be a global crisis, especially in children, with anywhere from 300 to 500 million cases per year, and almost all of these are in sub-Saharan Africa. Mortality has been estimated in recent years to be around 1 million deaths a year, and most of these are in young children, particularly in Africa, and other high-risk groups are indicated. But there has been some progress in controlling malaria. The increased use of mosquito netting has resulted in quite a striking decreased incidence of disease, although it has brought some problems of its own. Increasing use of novel drugs and novel drug combinations, artesunates, artemisins, these have greatly improved therapeutic options. Here's a reference from Lancet for those that are interested. And there continues to be progress toward malaria vaccination. This is an interesting study published in the Lancet looking at a novel adjuvant that's now approved for use in children in the United States. Up until just a few years ago, the only adjuvant we could use in the United States was aluminum or alum. But now we have better adjuvants that drive more of a Th1 cytokine response that appear to be more useful in the management of these diseases. And here's the Kaplan-Meier curves showing the impact of vaccination in an African study, modest but still striking. And then a paper that was published just 2 weeks ago in the JCI for those that are interested. This is by Chan and colleagues. They've identified now an interesting target, a surface protein, 37 kilodalton surface protein, that seems to correlate with protection against disease. So in other words, this plot shows individuals who have protection against malaria in malaria-indigenous areas, and it correlates very strongly with the presence of antibodies against this protein compared to those who are unprotected. So this paper from a group in Australia may yield some novel approaches to malaria vaccination, and for those that are interested in malaria, I would recommend that. JCI, August 2nd. Okay, James Polk, elected President of the United States in 1844. Interesting historical tidbit, he was the first President of the United States to have his photograph taken while in office. Polk was a hawk. He was a very, very aggressive, military-minded president and favored fighting for annexation of Texas and the Northwest Territory. There was a famous slogan from his era, 5440 or fight, which tried to define the northernmost boundary of the Oregon Territory along the 54th parallel. With compromise, it was dropped down to the 49th. So here you can see it bisecting Vancouver Island. Polk realized that he didn't have the resources to fight 2 wars at once during his administration. So rather than have a third war with Great Britain in a 70-year period, he elected to compromise on the border of the Oregon Territory. Well, shortly after he left office, he made a goodwill visit to New Orleans and died shortly after visiting New Orleans. He had an explosive, watery episode of diarrhea with severe dehydration and really had a very, very short illness resulting in his death. So when you hear that, what do you think of? Do you think that he likely died of cholera? Did he have E. coli 0157H7 with associated TTP, sort of the adult homologue, if you will, of hemolytic uremic syndrome in children? Did he have Bacillus cereus associated enteritis, Shigella sonii, or did he have cytomegalovirus enteritis? What do most medical historians think? So it looks like a fairly equal split. Come back to this again, refresh it. Yep, most of you got it. So he had cholera, classic cholera. And important to recognize that cholera continues to be a major problem in the Western Hemisphere. Why is that? Well, cholera, of course, you remember the mechanism of activity. It's the ADP ribosylation of this protein complex that leads to continuous activation of adenylate cyclase, which leads to a dramatic sodium loss through the CFTR anion exchanger and dramatic water loss through the lumen of the gut. There are vaccines for cholera. The killed injectable vaccine is not very available now. It had a relatively poor efficacy. Oral cholera vaccines are available, safer, but it's hard to get them, and they aren't hugely effective. The main reason cholera is in the news, though, is because of the continuing tragedy in Haiti. And here you can see areas of Haiti that are hyper-endemic for cholera, including the area around Port-au-Prince and areas to the north. And through molecular genotyping, it was shown that the UN troops and volunteers that went in to try to help actually brought cholera into Haiti, back into the Western Hemisphere, and it was likely introduced by individuals from Bangladesh. And this is actually in the news. Just a couple of weeks ago, there was a vote in the House of Representatives to try to really push toward trying to resolve this ongoing crisis. And you can just see down here the continued toll. There have been 7,400 deaths due to cholera in Haiti, and almost 600,000 cases since the first cases were detected in October 2010. And that's less than 2 years, an enormous burden and toll on the people of that island. Okay, Zachary Taylor, elected president in 1848, nicknamed Old Rough and Ready. On the 4th of July, Zachary Taylor attended festivities at a newly dedicated area in Washington, D.C. that later became the Washington Monument. And so it was shortly after his administration that the construction of the Washington Monument began. It was noted by newspaper reporters and other observers at the time that he gulped down a huge number of cherries and iced milk, and then went back to the White House and developed fever, diarrhea, and sort of these red spots over a period of in the next few days. And eventually this killed him. He died in office, one of the presidents to die in office. So what do you think? What infection did Zachary Taylor maybe get from these cherries and milk? Was it Ascaris? Was it Trypanosoma cruzi or Chagas disease? Was it Salmonella typhi or Salmonella typhimurium? Or was it cryptosporidiosis? What killed poor Zachary Taylor? Okay, and so most of you got this on the button too. He did have typhoid fever. At least it's largely believed by most historians. And just to provide an update on what's new with this particular pathogen, I wanted to remind the audience that this is a disease that continues to have high endemicity throughout most of the world, including the Pacific coast of South America. There are vaccines to prevent typhoid fever, and for those who do travel medicine, you're familiar with these options. There's an oral live attenuated vaccine, so a mucosal vaccine, a strategy for immunization that is in general underutilized in the clinic. And here's just the information about the dosing schedule. And then there's also a capsular polysaccharide vaccine. There are common adverse events associated with the capsular polysaccharide vaccine, including striking erythema and induration at the site of inoculation in many individuals. And so that one is probably not the preferred product. Well, let's talk about the Harrisons. William Henry Harrison. Many of you probably know the historical trivia associated with Harrison. On his inauguration day, it was a cold, bitterly cold day in Washington, and he stubbornly refused to put on his overcoat because he wanted to be comfortable while he gave his inauguration address. And so, against the advice of all of his people, he just stood there in a regular coat and shirt. And of course, as Mom always taught us, being in the bitter cold like that makes you sick. And sure enough, he died 1 month after his inauguration. William Henry Harrison was actually a former medical student. I bet a lot of you didn't know that. So Harrison sort of predated the story that went with his grandson, Benjamin Harrison. Benjamin Harrison, in a different era in American history, was elected in 1888. He lost the popular vote. So even though he lost the popular vote, he did win the presidency through the Electoral College. And we've had recent experience in this country with that phenomena. In this era of talk about budget deficits, it's interesting to note that the first budget deficit in the United States Treasury was under the Benjamin Harrison administration. And shortly after leaving office, he died in 1901 of pneumonia. So both Harrisons died of pneumonia. So let's think about pneumonia a little bit. And I apologize that this is hard to read, but an interesting monograph just recently was published about the management of community-acquired pneumonia in infants and children older than 3 months of age, clinical practice guidelines by PIDS and the IDSA. And as pediatricians who treat community-acquired pneumonia all the time, which of the following statements do you think is correct? Should we be using amoxicillin as first-line therapy for CAP in preschool-age children? Should we instead be using a cephalosporin as first-line therapy for CAP in preschool children? Or, trying to pick up mycoplasma and other atypicals, should we be using a macrolide antibiotic? Or what about choice D? Antimicrobial therapy is not routinely required for preschool-age children with CAP because viral pathogens are actually responsible for the majority of clinical disease. Or is it E, a combination of a beta-lactam and clindamycin? Which of those statements is correct and keeps us at the cutting edge with the current guidelines? Let's see if anyone remembers. And so I'm hopeful that the residents will get this right because we just talked about it last Friday in your journal club. And so let's see what the audience thought. Okay, so most people went for amoxicillin. Tried and true agent. It's been around for a long time. Nobody was very impressed with the idea of a cephalosporin as first-line therapy. And I can't believe that no one went for the Z-Pak. Let me just refresh that and make sure that's true. Okay, there's a couple Z-Pak aficionados. But it was actually less than half of the audience that got the correct answer, which is actually D. Antimicrobial therapy is not routinely required in children at this age. That's a sea change for a lot of us who, in a child with pneumonia would be very, very nervous about not using antibiotic therapy. But it was a very important paper. My former mentor, John Bradley, was the first author on that paper. And as I say, it was discussed in resident journal club. So I know the residents all got that one correct, even if most of the audience didn't know that answer. Okay, so here again is just sort of a summary of recent events in CAP. The microbiology, this is in adults now, includes respiratory viruses as well as pneumococcus, mycoplasma, H. flu, chlamydia pneumoniae. But in children, it's now a recommendation, as I just alluded to. This is from the recent Bradley paper. You can download it for free off the web. Antimicrobial therapy not routinely required for preschool-age children with CAP because viral pathogens are responsible for the great majority of clinical disease. Okay, Franklin Delano Roosevelt, the first four-term president. The fact that he was elected 4 times to the presidency is what led to the eventual passage of the 22nd Amendment to the Constitution, which limited presidential terms to only 2. This president, of course, had poliomyelitis, and as you know, it was a very interesting history. He was only photographed twice in his whole presidency in his wheelchair. He took great pains to try to look as functional as he could. It was a very different era. Well, when did he get his polio? What do medical historians think? In the summer of 1921, late summer, he took a vacation off the coast of Maine and did a lot of swimming, not only in the sea but also in swimming pools. And then by mid-August, he began to feel weak. He developed a high fever and a weakness in his legs, and by August 12th, he could no longer stand, and he had the onset of paralytic poliomyelitis. So what can we say about this virus? This is an important virus still. And what is this virus? Does anyone remember? Is it a hepadnavirus? Is it an arenavirus? Is it a picornavirus? Is it a paramyxovirus? Or is it a toga virus? John Belushi virus, toga. And people do remember from medical school, this is a picornavirus, a large family of single-stranded RNA viruses that include the non-polio enteroviruses, important pathogens this time of year in most temperate climates, and the etiologic agent of the common cold, rhinovirus, is also a picornavirus. And so what is the latest with polio? It's actually a remarkable story that's unfolded in really a very, very short period of time. You can see here in the 1980s the countries in which polio was still a concern. But in the year 2012, thanks to very aggressive concerted efforts by the WHO, Afghanistan, Pakistan, Nigeria are the only countries left in which there is still native polio circulating. And so we really are on the verge of global polio eradication. Of course, the goal of any vaccine program is to ultimately anticipate the day when you won't need to give the vaccine anymore. And so through the Global Polio Eradication Initiative, there's been enormous progress. Hundreds of millions of doses, literally hundreds of millions of doses administered in polio endemic areas. Here you can see in this graphic the data from India. India now has been polio-free for over a year, a remarkable achievement. And so this has been, I think, a wonderful area of progress. Okay, well, let's move into modern times. Everyone remembers George I. He was elected president in 1888. And in an unfortunate time in his presidency, he actually got sick, a little problem with the Japanese prime minister. He had apparently had some sort of gastroenteritis. A little clip maybe to help you if you don't remember.
ABC News has obtained a videotape that shows clearly what happened when the president fell ill. Here's White House correspondent Ann Compton.
The lone camera in the dining room was locked in on the head table when President Bush was overcome by nausea and fell forward. It appears he lost consciousness as he toppled over onto his host, Prime Minister Miyazawa. The new scenes show First Lady Barbara Bush acting quickly, recognizing her husband needed help, bringing her napkin to his mouth, then stepping back to let the Secret Service agents take over. As the commotion became more frantic, one agent told guests to stay back. Then he vaulted over the table to help. Moments later come the scenes replayed so many times in the last 3 days, the president recovers enough to apologize and leave. The nausea had plagued President Bush all evening.
Yeah, poor President Bush. And you know, George Bush Sr. was a distinguished veteran, World War II, a fighter pilot who was shot down by a Japanese group. It's interesting, Japanese military. It's interesting, there's some bloggers even today that say that he did this sort of to get even with the Japanese for shooting down his plane. But that's, here's another rendition of it, of course. This is Dana Carvey's version from Saturday Night Live. Life imitates art. So, gastroenteritis. President Bush had gastroenteritis and had an unfortunate episode with the Prime Minister of Japan. Which of the following statements about gastroenteritis is true? Think about what he probably had, and is it true to say that licensure of a vaccine against this agent hasn't really had any impact on the epidemiology of infection, since most children have the infection by the time they get the vaccine? Is it true to say that there are two different versions of this vaccine available in the United States? One derived from a human strain, the other one derived from a bovine strain, a cow strain? Is it true to say that there's no vaccine against this infection? Is it true to say that the use of vaccines had to be permanently suspended due to the finding of porcine circovirus genome in vaccine lots? Or is it true to say that this infectious agent was shown to be the etiology of gastroenteritis by a study published in the late 1960s where prisoners were fed stool filtrates to see if it induced diarrhea or not? This was in Maryland, male prisoners. Which of the following statements is true? Okay, so there's a mix. So I'll give anyone credit for E. It's actually a true story. It's a different virus. That was Norwalk virus, and I think it's quite remarkable that it wasn't that many years ago that we were actually feeding stool filtrates to prisoners to try to prove that Norwalk virus caused diarrhea. I'm not sure if you could do that study today. Some people thought that the vaccine licensure was moot, choice number A. A few of you thought, well, maybe there are two different versions of this vaccine available. A few of you, most of you, felt that there was no vaccine against this infection. And if you were thinking Norwalk, I'll give you credit for that too. No one bit on D, and that's good because the misleading word in the question was permanently. Although the use of vaccines against rotavirus was temporarily suspended because of the finding of this very unusual porcine circovirus. So most of that story is actually true. But the FDA decided after much deliberation and wringing of hands that it probably wasn't going to hurt anybody. And so the question, the answer I was going for is actually B, but you could make a case for C or D. And so what can we say about rotavirus? Winter vomiting disease. Bush was there in the middle of winter, and so it seems like a tempting pathogen to blame this on. There are two different rotavirus vaccines that have been licensed for use in the United States. One developed by GSK, another developed by Merck. And rotavirus continues to be a very serious pathogen in the developing world, where it's estimated that it kills 400,000 to 500,000 children each year. Before licensure of rotavirus vaccine in the United States, it was estimated that there was 25 to 50 deaths related to rotavirus infection, most of that being due to the attendant fluid and electrolyte disturbances that occur. These are the two different variants of rotavirus vaccine. One is a human isolate, developed by David Bernstein and Dick Ward in Cincinnati. It's had been passaged many times in cell culture, and it was of interest that in the clinical trials, it was broadly protective against all of the different rotavirus groups, and there are quite a number of different rotavirus serotypes. That was the inspiration for the RotaTech vaccine, which actually did build on a bovine rotavirus background and inserted human rotavirus genes to make a reassortant virus that actually has multiple different virus subtypes in it. And when people were first contemplating rotavirus vaccine development, it was felt that you needed something that might be broadly protective against all of these strains. The single subtype, though, was equally protective. The rotavirus vaccine sort of takes advantage of the interesting molecular virology of rotaviruses. Rotaviruses are segmented genomes, double-stranded RNA viruses that have multiple genome segments. And so it's plausible to generate these chimeric viruses that reassort different genome elements into a novel strain. There's actually only one other important double-stranded RNA reovirus infection, at least in North America, and the residents might remember that that's Colorado tick fever. So what has been the impact of rotavirus vaccine on diarrhea and diarrheal illness in the United States since licensure of the vaccines? And this is, I think, a very important paper by Cortez et al., New England Journal, published just last year. And you can see not only in blue the total number of tests ordered for rotavirus infection, but also, more importantly, in red, the total number of positives. There's been really quite a striking decline. And if you do a PubMed search and just look at various combinations of terms that address the impact of rotavirus vaccine on rotavirus disease, many countries now that use this vaccine have been reporting similar dramatic impact on disease. And so we're in the midst of a very interesting phenomena, the possible eradication of rotavirus as a pathogen in young children. I want to be very cautious with that statement. But it's a popular vaccine. It's easy to administer. And there's been far less of the sort of anti-vaccine furor with rotavirus vaccines than most vaccines, which I think is interesting. A number of papers have been published just in the last few months, too. Basically all have the same title, Lack of Resurgence of Intussusception Following Licensure of Rotavirus Vaccines. Some may remember the first generation rotavirus vaccines in the late 1990s had to be taken off the market because of a possible link to intussusceptions, but we've not seen that in practice with the newer rotavirus vaccines. So that is all I had to say, just sort of a potpourri of infectious diseases from presidents of the United States, and hopefully neither one of these gentlemen will have any infectious disease-related issues. But given that it's presidential election season and it's ramping up big time, I thought it might be fun just to talk about some of these things. So thanks for your attention, and be glad to take any questions or comments. Eleanor Roosevelt? Yeah. She was treated for sarcoidosis during her life, but at autopsy she had miliary tuberculosis.
I think it was CDC.
Yeah, it was. That's right. I thought about throwing that in, but decided not to.
Thank you. That was
Yeah,
awesome.
thanks. Thank you.